Criminology Board Exam Reviewer. Forensic Medicine. Definition of terms. Part 1. Abrasion. It is a skin injury caused by scraping off of superficial skin due to friction against a rough surface. Adiposia. It is a peculiar waxy substance consisting of salts and fatty acids and formed from the decomposition of corpse tissues, especially in moist habitats, also called grave wax. Oedicus. It is the reproductive organ of a male insect. Agnosia. It is the impairment or loss associated with brain injury of the ability to recognize or comprehend the meaning of stimuli including familiar objects and symbols. Airways. It is any part of the respiratory tract through which air passes during breathing. Alveolar ducts. It is the smallest of the lungs' airways that connect terminal bronchioles and alveolar sacs, sometimes called bronchioles. Alveoli. It is a microscopic air sacs in which gas exchange between the blood and the lungs occur. Amnesia. It is the partial or total loss of memory for past experiences. Anethria. It is the loss of the ability to form words accurately caused by brain lesion or damage to peripheral nerves that carry impulses to the articulatory muscles. Anemia. It is any condition in which the number of red blood cells, the amount of hemoglobin, and the volume of packed red blood cells per 100 milliliters of blood are less than normal. It may result from increased destruction of red blood cells, excessive blood loss or decreased production of red cells. Aplastic anemia. It is an anemia caused by aplasia of bone marrow or its destruction by chemical agents or physical factors. Autoimmune hemolytic. It is acquired disorder characterized by premature erythrocyte destruction owing to abnormalities in the individual's own immune system. Hemolytic. It is an anemia caused by hemolysis of red blood cells resulting in reduction of normal red cell life span. Iron deficiency anemia. It is an anemia resulting from a demand on stored iron greater than can be met. Megaloblastic anemia. It is an anemia in which megaloblasts are found in the blood, usually due to a deficiency of folic acid or vitamin B12. Microangiopathic hemolytic. It is a hemolytic process associated with thrombotic purpura, prosthetic heart valve, and burns. It is visualized in the peripheral blood smear by fragmentation of the red cells and other bizarre morphology. Pernicious. It is a type of megaloblastic anemia due to a deficiency of vitamin B12, directly linked to absence of intrinsic factor. Sickle cell. It is a hereditary chronic anemia in which abnormal sickle or crescent-shaped erythrocytes are present. It is due to the presence of hemoglobin S in the red blood cells. Antibody. It is a protein produced for body defense in response to an antigen. An antibody is a substance that appears in the plasma or body fluids as a result of stimulation by an antigen and will react specifically with that antigen in some observable way. Anticoagulant. It is a substance such as EDTA that prevent coagulation or clotting of the blood. Antigen. It is a foreign substance, usually a protein, capable of stimulating an antibody response for body defense. Any substance that when introduced parenterally into an individual lacking the substance, stimulates the production of an antibody that when mixed with the antibody react with it in some observable way. Aplasia. It is the failure of an organ or tissue to develop normally. Asphyxia. It is the lack of oxygen or excess of carbon dioxide in the body. Asphyxia may lead to unconsciousness, seizures, damage to various sensory systems and death. Asthma. It is a chronic condition in which constriction, spasm, of the bronchial tubes occurs in response to irritation, allergy, or other stimuli. Atherosclerosis. Deposition of plaques of cholesterol esters in blood vessels, resulting in the narrowing of the vessel lumen and restricting blood flow. Atrophy. It is a loss of function due to age, disuse, or disease. Autism. It is a mental introversion in which thinking is governed by personal needs and the world is perceived in terms of wishes rather than reality. Extreme preoccupations with one's own thoughts and fantasies. Autopsy. It is a physical examination of the corpse through dissection to determine cause of death, also necropsy and post-mortem. Bestiality. It is a sexual intercourse by a human being with a lower animal. Biopsy. It is a small piece of tissue excised for the purpose of analysis.